Welcome to the Inspired Living with Autoimmunity podcast, the podcast for high achievers who want to stay sharp, focused, and full of energy despite their diagnosis. With your host, National Board Certified Functional Medicine Health Coach, Julie Michelson, where Julie helps you take your power back from autoimmunity. And now here's your host, Julie Michelson.
Welcome back to the Inspired Living with Autoimmunity podcast. I'm your host, Julie Michelson. And today we are joined by Dr. John Neustadt, founder and president of Nutritional Biochemistry Incorporated, and published author of over 100 medical articles and 4 health and wellness books. His most recent book is Fracture Proof Your Bones, a comprehensive guide to osteoporosis, which is the topic of our conversation today. Dr. Neustadt shares the importance of lifestyle in reversing and preventing osteoporosis and specific supplementation that can help keep our bones strong and healthy. John, welcome to the podcast.
Thank you.
I am so excited to have this conversation, as I already said before we hit record, because we really haven't done an episode dedicated to bone health. And as you already know, it's part of my personal journey in my family as well, and not in the way people may think. You know, people think bone health and they think older adult. So we'll talk about all of it. But you have such an interesting way you came to focus on bone health and nutritional supplements. So I'd love to hear a little bit of your journey. I'm guessing when you were, 12, this isn't what you thought you'd be doing.
Not only when I was 12, but when I was 25 and 28, and I came across this out of need. One of my mentors in medical school and one of the founders of my university, Dr. Bill Mitchell, said to me that if you listen to your patients, they will tell you what they need. And I was in clinical practice and I started working with people with osteoporosis. They were just coming to me. It's not as if I had some specialty in that area at the time. And I was doing what I was taught to do. And I thought I was doing a great job because their bone density was going up. I was working with them through integrative medicine. I was helping them with diet, lifestyle, nutritional supplements, recommending medications when they seemed appropriate. And my mother-in-law has osteoporosis, and I was helping her a little bit. It's always challenging waters when you're have a family member as a patient. And I also learned early on to stop doing that and avoid that
It's not
dynamic. But I was giving her some recommendations for some nutrients at the clinical trial support and dietary recommendations and exercise, those sorts of friendly advice. And she had her physician she was working with who had her taking Fosamax. Her bone density was going up. So her doctor was happy. She was happy. I was happy. And then she tripped on a throw rug in her house and broke her hip. And I thought to myself, something's wrong here. What's wrong with this picture? So I dove into the research. And what I found is that the nearly myopic focus, just solely focusing on that number on the test, that bone density test number, which is how conventionally it's treated, and even how integrative doctors also and integrative practitioners typically think about working with people with that disease. Focusing just on that number on the test and thinking you're doing a good job is leaving people dangerously unprotected. What the research shows is that a bone mineral density test only predicts 44% of women with osteoporosis and only 21% of men who will break a bone. And that's the most dangerous thing about osteoporosis. The danger is not the number on the test. The danger is, are you going to fracture? And that test or any recommendation, any test is only as valid and helpful as it can predict your fracture risk, and any recommendation is only as valid as it can reduce your fracture risk. And what we know with the dangers of osteoporosis is that every 30 seconds, someone with osteoporosis is breaking a bone. In fact, globally, it's second only to cardiovascular disease as a global health risk and issue. If you're a 45-year-old woman, your risk of an osteoporosis fracture is greater than your combined risk of breast, uterine, and ovarian cancer. And if you happen to break your hip with osteoporosis, there's up to a 36% chance that you're going to be dead within a year. And half of those patients who survive never regain their full pre-fracture level of mobility and pain-free lifestyle and ability to enjoy their life. So I became obsessed with really understanding not just what's going to change the number on the test, but how can I educate people, teach people, and create information and resources that actually not just promote healthy bone density, but maintain strong bones as indicated by reducing fractures in clinical trials, and educate people that those are the questions they need to ask, what to ask their doctor, how to create a holistic plan for themselves, and the resources that I can provide them to do that.
And I love it's so not surprising to me the traditional Western approach, and even in the integrative world, is, a number on a test, because that's the whole problem, right? It's like this, bone density in absence of all the rest of your health information, right? How strong are you? How stable are you? How's your balance? And we'll get to, I know we're going to get to it, but I want to add those numbers of later in life, especially for women, menopausal women. It's only if you do nothing, right? So we're never doom and gloom. And that's what your book is about. And that's what you're all about, is like, wait, we're whole people, and diet, movement, lifestyle, connection, community, all the things that make a healthy person, also, shocker, make strong bones.
Yeah. And it's hope based on the science.
Right.
It's not pie in the sky hope. This is what the research supports is the best way to not only promote your bone health, to protect yourself, but all of these integrative and holistic things that I talk about in my book, Fracture Proof Your Bones, also help reduce your risk for cardiovascular disease, dementia, cancer, all-cause mortality,
autoimmune expression,
diabetes, and on and on and on, because it's diet, it's lifestyle, it's exercise, and all of the systems in the body are connected. So if you're doing something that's healthy for your bones, you're going to be doing something that's healthy for your heart and your brain also.
Yes. And that connection of, exercise is essential for cognition and preventing cognitive decline. I mean, you cannot, again, we're whole integrated humans, and it's quality of life. I say this all the time. I didn't think I would be here having conversations at almost 55. But I don't want to just be here to be here, right? I want to be mobile. I want my brain to work. I want to enjoy my family and the things that I love to do. So quality of life and health span that's what we're talking about. And if your brain works, but your body doesn't, or your body works, but your brain, I mean, all the things. And so I really, this is why I got so geekily excited for our conversation today, because it's another area where the conversation needs to change. And that's what you're doing for us, is educating us.
Yeah, absolutely. And like the bone is more than just minerals. And that's what the bone mineral density test detects. It detects how many minerals, the quantity of minerals that somebody has in their bone. I don't really talk about it usually that way, but the amount of minerals somebody has in their bone. But if it were only minerals, it would be like a column of chalk and be brittle. So there are over 200 different proteins in bone. Bone also produces our blood cells, our red blood cells, our white blood cells for our immune system, and our platelets. It produces some hormones, and it has hormone receptors. There are actually serotonin receptors in bone and melatonin receptors in bone. So it's a complex, important tissue in our body. And there's a chapter in my in my book called, I think, Miraculous Bones. I mean, they're miracles. The more I learned about them, the more I gained an appreciation. I mean, it's just, they are incredible.
Well, and they're alive, right? So,
They're alive.
we
Yeah.
tend to think of, we only see bones usually, hopefully, when they're no longer in the body. Some of us, sometimes you see them when you shouldn't.
Yep.
But that's so important. And I already touched on hormones. So let's kind of go there. We think, okay, maybe some people think, young adults, your bones you're fully formed, you're done, right? Those are the bones you have for the rest of your life. But we're always could always be building bone and always tearing bone down. Can we talk about that a little bit? Because I really do think that most people are unaware of that this is an ongoing process throughout life.
Absolutely. That's crucially important. So men and women gain their peak bone density in about their 20s. So, 20 to 29, 25 to 29, so somewhere around there. And then the conventional wisdom and what we learn in medical school is basically it's a one-way street from there downhill. You're losing about 0.5% of bone density per year in women in particular. And I'll explain why women lose bone density.
It's always us.
Sorry about that.
For the same reasons, though. It's okay. We also can, carry babies. So it's
but
okay.
It can be reversed. So,
yes.
But what happens is that's not accurate in terms of that it's a one-way street. Bone is a living tissue. Bone is constantly old bone broken down and new bone built up in a process called bone remodeling. About every 10 years, you actually have all new bone. Bone has turned over. What happens is osteoporosis is essentially a disease of imbalance. The destructive forces are winning. And when you have balance between the bone building cells called the osteoblasts and the cells that break down old worn out bone called osteoclasts, your bone health is not changing. It's stable. As we go through puberty, as we're growing and you're getting more bone, well, there's more osteoblast activity building bone and relatively less osteoclast activity. And then what happens as we age, that balance shifts and the destructive forces of the osteoclasts take over. And that's when you start getting bone breakdown. There are lots of things that contribute to that. Some are in our control, some are not in our control. One of them, the biggest things that I see talking about that is in our control is medications. There is a long list of medications that destroy bone and create osteoporosis and increase the risk for fractures. Now, people need to be on medications. If you need to be on one, then you should stay on it. But it's important. It is. I consider it a modifiable risk factor because in many cases, through integrative approaches, you can either decrease the dose or get off the medication altogether or switch to a safer one. And I'll give you two examples. So some of the most commonly prescribed medications out there are antidepressants and acid blockers. Both of those categories of medications destroy bone. As I mentioned, there are serotonin receptors in bone. So people taking any medication that artificially increases serotonin, so that's like Prozac, Lexapro, Wellbutrin, those sorts of medications, they increase osteoclast activity, they increase bone breakdown. And so much so that there have been multiple studies and looking at the body of research that's out there, the authors concluded that for women taking this category of medications, like an SSRI medication, for 1 to 5 years, for every 19 women taking one, we would expect one to fracture. That's how dangerous they are for bones. And yet most doctors aren't aware of that. They don't know about that. They're well-intentioned, but they just aren't up on the research. The other category of medications, the acid blocking medications, taking one of those, specifically like a Prilosec, a proton pump inhibitor, which are available over the counter, continuously over time raises your fracture risk. It damages bone. So much so that the longest study was 4 years. And after 4 years, it increased the risk of a hip fracture by 60%.
Wow.
And the first FDA warning about that medication that went out, a letter by the FDA about that category of acid blocking medications and its ability to destroy bone and create fractures, went out and was released by the FDA in 2000. So this is not a new issue. And with those acid blocking medications, half of them are prescribed just for acid reflux.
Right.
And we know that simple dietary changes and in many cases completely stop the acid reflux, and people don't need the medication.
And can help with mood disorders. So, all of these approaches, you just gave me like an extra thing to put in my gratitude journal. But I was on prescription PPIs for years for side effects from the 8 other prescriptions I was on back when I was not well. So really grateful to know that my bone density is good and that didn't do good. And that goes to what we're saying too, right? There is, and we'll get into some other risk factors, but the body is resilient and we are designed to heal. So even not knowing what I didn't know back then, I feel better and I'm stronger and my bones are healthy, which I would not have thought possible.
Yeah, and to your point, we were talking before you started recording about celiac and the connection between celiac and osteoporosis. And the research shows that in children and young adults who are osteoporosis can be the only sign of celiac disease. And once though you get them on a gluten-free diet, the bone density can reverse. Their bones can heal and become healthy again. And similarly, people on prednisone, commonly used for autoimmune diseases, that damages bone. It is so destructive. And most physicians know that and are aware of that.
Right.
And once you come off of the prednisone, the dexamethasone, however, over time, that risk for fracture decreases. Now, we don't know if it ever gets back to what it was before the medication, but it does decrease the risk for fractures once you're off that medication. Once you remove what's damaging it, your body has the opportunity to do what it wants to do anyway, which is heal and thrive, which is why, like to your point about diet and nutrients and mental health, we want to give the body all of the raw materials, the environment in which our bodies can flourish and do the job that they want to do for us so we can feel amazing.
And it is, I'll share, I don't think I've ever shared this on air before, but that was what we were chatting about before we started, was my son, who I now know has celiac, but before we knew, and again, if I knew then, my kids, we laugh around the dinner table about my parenting skills when it comes to health back then versus now, but because he had horrible GI issues literally from birth, and nobody ever said, what are you eating? Or, that was never part of the conversation. But he was, as a young kid, like end of elementary school, beginning of middle school, had osteopenia. And they wanted to medicate him. And I confess to you, that was probably my one good health-related parenting decision back then. I said, let's just wait. And luckily, he was not long after diagnosed with celiac. We never did it. We never treated the bone health. He's 28 and his bones are great and he's healthy and strong. Fantastic. And it is the only thing he has done. He does not live a totally healthy lifestyle like his mother would like him to, but he's gluten-free.
We all have that dynamic with our kids.
Yeah. Yep.
Love them to eat better and sleep more.
Please. Yeah.
I've got 2 of my own. Yes.
Yeah. Yep. So luckily, he's my oldest. My other 2 are a little more proactive about full lifestyle. But it is amazing. And so again, we think of this as an older, an aging issue, and it is not always an aging issue, because of some of these lifestyle factors. One thing kind of connected to age, but can happen pretty early on, that I really do want to talk about is hormones, and women especially. Can you tie that up in a bow for us? Why? To me, that is a manageable risk factor, I think.
Absolutely. 80% of osteoporosis occurs in postmenopausal women. And the
Say that
reason why,
again.
Mhm. Again, yes.
Yeah. Well, because if you look at Alzheimer's numbers or, all of these major life impacting chronic health conditions, that's where you just kind of fall off that cliff for
Right.
risk if you're a woman.
And what's happening with bones is a decrease in estrogen and progesterone during menopause. Through menopause and for the 10 years after menopause is the fastest rate of bone loss in women. And that's because of that drop in estrogen. Estrogen is considered what's called an anabolic hormone. That means it builds bone. And why don't men suffer from this? Because, we produce testosterone. Well, estrogen actually comes from testosterone in the body. So we have enzymes and the mechanism to take testosterone and convert it to estrogen. And so it's thought that the reason why men don't suffer with this is because they're not really getting that drop, that change in hormone levels as dramatically as women are. And so when the estrogen drops, estrogen has many roles, like all hormones do in the body. One of them is to promote osteoblast activity, the bone building activity, promote collagen production. So bone is more, like I mentioned, the proteins in bone. It's more than just the column of minerals. One of the major proteins in bone is collagen, and it's the collagen that gives bone its ultimate strength and flexibility. Collagen, strand per strand is the tensile strength is stronger than steel, and it's also flexible. So having healthy collagen levels in bone allows somebody to fall, for that impact to go through the bone, be dispersed, and the bone to deform a little bit and not be brittle, to absorb it without breaking. And so lowering estrogen, decreasing estrogen also affects collagen. It also affects sleep. And insomnia is a risk factor for osteoporosis and fractures, not getting adequate sleep. So that's why in postmenopausal women, you're getting a higher rate of osteoporosis. Now, that said, the assumption, unfortunately, if a physician has a postmenopausal woman coming to him or her and they have osteoporosis, they're going to think, oh, it's menopause. But 30% of osteoporosis in postmenopausal women is caused by other things. Yes, the drop in estrogen is a contributing factor, but there are other things going on. And those almost never get evaluated. And part of the challenge is how doctors are trained, what the economic incentives are in medicine. There was a study that came out a few years ago out of Europe that there's just a lot, doctors just aren't adequately trained in this disease to treat it how it needs to be treated. And I can go into that if you want, but the bottom line is there are ways to look at and evaluate through an intake form, somebody's lifestyle, the medications they're taking, independent of the age that they are, to really understand, are there other potential contributing factors here? And there are ways to evaluate a bone density test, a little more subtle, nuanced evaluation of those test results that can point to what's called a secondary cause, something else causing it, like a medication or a disease process, and not just the drop in estrogen. And so that's where my book hopefully is very helpful, is it walks people through these different issues and provides questions for them to ask their doctor to make sure they're really getting the best possible information and advice so they can make the best decisions for themselves and their health, and create a holistic bone health plan to help reduce their fracture risk and maintain bone strength.
Which I think is so important. And your book is such a gift because, we're talking about, I'm guessing, that definitely it's the go-to resource for somebody when they hear they have osteoporosis or they were sent for a scan, they're in that realm where they're starting to talk to their doctor about, am I osteoporotic or not? But everything in your book, if we were to just read it early, Right.
That'd be great.
Which is why you and I do what we do, right? It's
Yeah.
yes, we want to help the people that are already, for me, it's already where I was. But it's this is the knowledge. This is where there's the empowerment to heal, but there's also this empowerment to prevent. And so this is where I think your book is so impactful and so important. And we could talk for 5 hours. Like I already have a mental list of questions. But I want to touch on, so we talked about hormones. And so I'm not a physician, but bioidentical hormone replacement, I've had, amazing cancer expert. I mean, you name a concern with bioidentical hormones, and it's already been addressed on the podcast. I look at it this way. Our hormones decline, like, because we're just getting ready to shrivel and die. And I don't want to shrivel and die. And so to keep bones healthy, brain healthy, your inflammation down, all of the things, we can put that one aside. I want to talk about some of the other just lifestyle areas. I'm so excited you mentioned sleep. I'm such a geek about that. Again, brain health, all the things, right? We heal in our sleep. So it's not surprising that the people that aren't getting enough sleep, it's affecting your bones as well. Again, we think of them as like this separate part of the body, and it's just part of the body.
That's so true. I just quickly, briefly to mention the hormones. I'm glad you brought it up. The research is clear that when it comes to bone health and osteoporosis, hormone replacement therapy builds bone, but more importantly, it does reduce fractures. So one study showed overall a 40% reduction in fractures. Another, specifically the most dangerous type of fracture, hip fractures, 28% reduction in hip fractures, looking at a meta-analysis, combining different studies together, the data. So it can be done safely. And we're just talking about getting things back into the normal range.
Right. We're not talking about
super
crazy
high dose. It's just
Right.
you're a little deficient, like a nutrient that you're deficient. And that's how I encourage people to think about it. If I'm deficient, low in iron, well, I'm just going to give myself some iron to take iron to get me back in the normal, healthy range.
Right. And so okay, we can put that that one to rest. What else? You mentioned a little bit. So you touched on sleep and the importance of sleep. And again, there are resources for all of us. So, not everybody is short on sleep because they're working too many hours. So if you have sleep challenges, we've had episodes on the podcast with sleep specialists, and there's a lot of ways to improve sleep. But what else should people, and I know it's all in the book, and I encourage everybody to get the book, because that's the beautiful thing. These are the lifestyle pillars for wellness, period. No matter what condition, these are the things our body needs to stay strong.
Absolutely. The other thing I would want to touch on is supplementation, because I think there's a lot of misinformation out there on the internet, a lot of mischaracterization of the research. And when you look at bone health supplements out there, you can see a long list of ingredients in some of them. Calcium and vitamin D is commonly known and commonly recommended by all medical associations for bone health and osteoporosis. And I agree with that. That's a good recommendation, because the research shows that taking and getting adequate amounts of calcium and vitamin D are associated with a 18 to 23% reduction in fracture risk. So again, not just about bone density, but what about fractures? Other than that,
question on that though, is calcium safe across the board for people to be supplementing if they just period?
Great question. The current recommendations of the Bone Health and Osteoporosis Foundation and the American College of Preventive Cardiology is that taking calcium up to 2,000 to 2,500 milligrams per day, you can't get within that range. If you get up to 2,000 to 2,500 milligrams of total calcium a day, that should be avoided. That's dangerous. Okay. Taking it up to the USRDA, of the recommended amount for bone, 1,200 milligrams per day, is considered safe.
Okay.
And what's interesting is so many doctors, I get people coming to me, and my doctor said I need to take 1,200 milligrams of calcium, or I need to take 1,500 milligrams of calcium. And it's just the wrong recommendation, because the US recommended daily allowance for any nutrient is the total intake. That's from diet and dietary
Right.
supplements. And getting more than 1,200 milligrams of calcium is not associated with any improved bone health outcomes. So that's really just what you need. And you definitely don't want to get, up to 2,000 to 2,500. Then you run into some risks. So the average American woman consumes about 800 milligrams of calcium in her diet.
Okay.
And the average American man about 1,000 milligrams of calcium. So just getting about 400 milligrams as a dietary supplement is fine. And if you end up getting a little bit more, there's a buffer of safety, 500, 600, 800, you're still in that safe area. But being conscious that not everybody needs to be taking 1,000 to 1,200 milligrams, the recommendation should be customized. And on average, just getting 400 milligrams, that's really all most people, frankly, need.
Thank
With
you
vitamin
for going into that one, because I know I broke my shoulder, oh gosh, 6 years ago. And they did that at your age, you need to be taking this much calcium. Well, I have cardiac concerns in my family, and there were reasons I chose not to, and they were shocked at how quickly I put bone back in. I want a follow-up question. I'm a little afraid to ask it. I'm rolling the dice. I'm trusting in everything I've ever heard you say in other interviews.
Yeah.
Because this is a question I get all the time as I'm working on reducing inflammation and gut healing and customizing, nutrition plans for people. Do you have to consume dairy to get enough calcium
absolutely
for
not.
bone
Absolutely
health?
not. No. In fact, there's a blog on my website, 10 top non-dairy sources of calcium.
Finish.
No, you absolutely don't have to.
Thank you.
You can,
Right.
but no, it's not necessary. Just quickly, in terms of vitamin D, I do advocate people get their vitamin D levels checked and tested.
Yes.
The research supports that for fracture reduction, the maximum benefit is when your vitamin D is between 30 and 44 on the blood test nanograms per milliliter.
Okay.
Now, a lot of doctors, including myself, advocate even higher than that for immune health, 50
We do
to
too.
60.
Oh, I go higher.
Yeah, 50 to 60 is what mine is higher than that. I do recommend typically higher, but 50 to 60 is the minimum.
Is a baseline. As a baseline. And I get so many people. I want to follow up or add to for listeners, why you're saying that is because it's a fat soluble vitamin. So unlike a C or a B, you're not going to pee it out in the toilet, and we don't want you. It is important to test. People ask me all the time, how much D should I be taking? I'm like, I don't know. Let me see your labs.
Right. That's true. But the research support, if you take up 2,000 IUs of vitamin D, that's sufficient to get most people in that healthy range pretty quickly as a minimum. Now, a lot of doctors will go higher. I take higher than that every day as well.
It took me 8 years on way higher than that to build up. I was down in the 20s. Which I see a lot with my autoimmune patients. They'll come in, my clients will come in if they're not supplementing, or they're taking 2,000 and they're still below 30.
Well, there are cases though where people do need higher than that. Obesity, people who are obese, who have malabsorption issues, who have autoimmune conditions, they oftentimes need much higher doses than that to get their vitamin D up. So that 2,000 units is, just kind of for the general population. So other nutrients that are important. So the way that I look at the research and the way that I think about this and nutrients is what nutrients have been shown in clinical trials, not only to promote healthy bone density, but to maintain strong bones as indicated by fewer fractures in clinical trial volunteers. Now, as I said before, there's a whole long list of nutrients that people, companies are throwing into their supplements, just like it's the kitchen sink. Let's just throw everything in there. There are only 4 actually that meet that criteria. Only 4. And one of them I have safety concerns about. So The two I already mentioned, calcium and vitamin D. The third one I would mention is a specific form of vitamin K2 called MK4. Now, in dietary supplements, people will see MK7 as a form of vitamin K2 and MK4 as a form of vitamin K2. Now, they are both types of vitamin K2, but they're not the same molecule. As we know in biochemistry, if you change one carbon atom, you can get overlapping benefits, overlapping activities, but also quite different activities as well. So MK7 in clinical trials has only been shown to slow down how fast somebody loses bone, how fast they're losing that bone density. And there are no clinical trials, zero, in volunteers showing that it reduces fractures. As an outcome in the clinical trial, it hasn't been studied as an endpoint. So it doesn't.
We don't know.
We don't know. And it doesn't promote healthy bone density in terms of increasing bone density. It just slows down how fast somebody loses it. In contrast, MK4, and by the way, MK7 is not produced by humans. It's produced by bacteria. MK4 is the preferred form of vitamin K2 that accumulates in our bodies, that we can actually manufacture small amounts of it. We can convert MK7, we convert vitamin K1 to MK4, but in much higher doses than you can get in diet, which is why you need to supplement with it, and much higher doses than what our own biochemistry can manufacture. MK4 has been shown to increase bone density, so promote healthy bone density and maintain strong bones, as indicated by over 70% fewer fractures in clinical trials in postmenopausal women with osteoporosis. And that MK4 dose that was used in those clinical trials was 45 milligrams per day. And it's been so well studied that's been approved since 1995 by the Ministry of Health in Japan for bone health. There are over 25 clinical trials on it.
Why are we so always late to the party in this country? It's amazing.
Yeah, that's another
podcast. That's a different conversation.
But the reason why I became an expert in this research and lecture about it at medical conferences is because when my mother-in-law fractured her hip and I was working with patients in my clinic and I started looking at the research, I learned about this powerful nutrient MK4, and there's nothing in the US that had that dose of MK4 in it. So wow. That's why I created my company, NBI, to create solutions that didn't exist. So many products on the market do not have the combination or dose of nutrients shown in clinical trials to actually work. They maybe will cite a study, but then they'll use less of the nutrient, a lower dose that was actually shown to even work. So I created my Osteo-K minis and Osteo-K formulas with that clinical dose of MK4 with calcium and vitamin D to be a very targeted bone support solution for people. And the only difference between the formulations is the amount of calcium, like we talked about. Not everybody needs the higher amount. Some people need lower. So the Osteo-K minis has less calcium.
Interesting. And so the fourth one that you have the qualifier.
Yeah, the fourth one is strontium. And that's people hear about that on the internet as well. Strontium is a mineral. It was approved in the European Union for osteoporosis. And yes, strontium has been shown to improve bone density and reduce fractures. However, every clinical trial that's been done was on a form of strontium called strontium ranelate. That's what was approved in Europe and used as a medication. Strontium ranelate does not exist in the United States. In dietary supplements, it's only a strontium citrate. There are no clinical trials on strontium citrate showing that it improves bone density or maintains strong bones. There are no fracture outcome studies on strontium citrate. And so we can assume, okay, well, let's assume that it's not really the ranelate part. It's not the citrate part that's doing the job. It's the mineral. It's the strontium that's actually having the benefit. So let's just, for argument's sake, give that benefit of a doubt. Well, what do the clinical trials in Europe show for strontium ranelate? Well, 5 of the 6 large clinical trials that were run that were part of the approval process showed that it only reduced vertebral fractures. It didn't reduce hip fractures. Only one of the studies showed a statistically significant reduction in hip fractures. So it's not clear that it actually works to reduce the most dangerous type of fracture. Importantly, post-marketing research determined, however, that for every one fracture that's prevented, the strontium medication was creating blood clots that could cause strokes and heart attacks.
Well,
so for every one person
thanks.
You're helping, you're potentially giving somebody a stroke and a heart attack. So it was removed from the market. Now, strontium citrate may be safe. It may not. We don't know. And in addition to that, strontium as a mineral incorporates into bone. Strontium is heavier than calcium. And so what happens in a bone mineral density test, the x-rays of a bone density test bounce off the minerals, and the way that they bounce off, the angle that they create when they're deflected, is then interpreted by the machine. And that's what calculates the test results, what's called a T-score and a Z-score. That's what determines your bone density. But because strontium is heavier, it changes how the x-rays bounce off of bone and creates a false bone density test result. So despite the fact that bone density tests have their limitations, I personally want them to be as accurate as possible, because it is one indication. It's not the most important indicator of your fracture risk, but it is one important indicator.
Wow. Well, I know I'm not trying it. And I'm very experimental. And I want to touch on, you have this supplement company because, again, out of necessity, right? You weren't able to, as you're doing the research, to provide your patients with the supplementation that you knew would help them. Can you define supplement for me?
Great question. I love
people
that.
just think, fine, I'll just take the supplements, and the other stuff just seems like it's too much work.
Right. Not a good attitude, in my opinion. Not the best attitude.
And that's, to be fair, they're probably not listening to this podcast if that's their attitude, but we all know those people.
So I agree with the FDA and really recommend people take dietary supplements as the FDA and the law intended. That is, as a supplement to a healthy diet. Diet and lifestyle are always first. That's why in my treatment plans, there was always diet and lifestyle first. The supplements were just to support those processes in the body. Now, dietary supplements are not approved by the FDA to diagnose, treat, prevent, or cure any diseases. They should be viewed and used as a supplement to promote health, promote healthy physiology, to promote bone health. And with respect to diet, there are certainly reasons why people will want to supplement. So, for example, MK4 is in dairy products, but you can't get enough of the MK4 that's been shown to support bone physiology and bone health. You have to supplement in order to get that higher amount. And by the way, as an aside, the MK4 has been studied not only in postmenopausal osteoporosis, but because we mentioned medications before, there are multiple clinical trials showing that it stopped and reversed improved the bone density tests in people taking medications like prednisone and leuprolide, for example. So it's been studied in different situations. So back to the supplements. So there are other reasons why you should supplement. Protein is a good indicator, I believe. A lot of people, even if they say I'm following such a healthy diet, are not getting enough protein, adequate protein as we age to maintain muscle mass.
I would say most people, and especially women.
Yes.
Like women just tend not to focus on protein.
Yeah. So based on the research, I recommend people get a minimum of 1.3 grams of protein per kilogram body weight per day. And this is in my book. Now we don't really think in kilograms, we think in pounds. So if you just take your body weight in pounds and you multiply it by 0.59, that's the minimum amount of protein people should be getting. Unless, of course, they have, chronic kidney disease or on dialysis and they've been put on a low protein diet.
Sure.
Right. And that can be difficult to get that amount of protein in diet. And so that's where a protein supplement can be helpful. Similarly, supplementing with a collagen supplement, which collagen has been shown to promote healthy bone density, support healthy, skin and nails and that sort of thing. Then, maybe protein are the building blocks of collagen. So if you're getting enough collagen, enough protein, then your body can produce collagen. But you also can supplement with a collagen dietary supplement that has hydrolyzed collagen peptides in it that are the building blocks of collagen. You're just giving your body the building blocks in a concentrated form to produce more collagen.
Love that. Such amazing advice. And again, this is where, I cannot recommend enough, like pick up Fracture Proof Your Bones. Because as I said, anybody listening, this has to be somewhere, on your mind, or should be on your radar. And it is something that I joke, not joke, it's true. As I work with women, I work with men also, but again, numbers, right? I work with more women.
Right.
And to change those dynamics of how children are growing up, with lifestyle forward thinking and actual education on what is a healthy lifestyle, what does it include, also is like, hey, let's protect our bone health as we go. I mean, I have 3 like really active athletic kids. I'm an equestrian, my daughter's in a competitive we need our bones to be healthy. I mean, we're
Absolutely.
going to tumble if we're having fun. So at any age, it's important to be aware of, and I think the book is great. I'm excited about the resources, just your supplement lines, so that people can actually get the dosage and the forms of these supplements that they need. I think is so important. So I'm glad you answered the call. So before we wrap, what is one step that listeners can take today to start to improve we'll go with bone health?
Great question. I think one step is, especially, and I'm talking to people who have a diagnosis of osteoporosis. So
Okay.
people who have gotten that bone density test result, they've gone into their doctor to review it. They have the diagnosis, oftentimes almost 100% of the time, not 100%, but most of the time, the doctors are recommending a medication right away. Now, medication may or may not be a good recommendation for you, but I hear over and over people come to me and they've just felt so much pressure to start the medication immediately when they have that first visit with the doctor where they reviewed the test results. They've had no time to let anything sink in, and they're being told they have to take this medication. And I just counsel people, take a deep breath. Let's take a deep breath. This is not an emergency. There is time to educate yourself and put a holistic bone health plan together that works for you. And a medication may be part of that, but not necessarily. And so that's where my book is an important resource, because it walks people through doing just that. Questions to ask their doctor to make sure they're getting the best advice, including on medications, and how to create step by step a bone health program that makes sense for them.
I love that. And this is all back to my goal in life, is empowering people, right? We have input, and it's our body. And so we need to educate ourselves so we can ask the right questions and not fall for the scare tactic of, nobody lost their bone density overnight. So I love that you say, this is not like, you don't have to address it this week with medication. And I always qualify too, I'm not anti-prescription either. There's a time and a place.
Absolutely.
But nobody was born with a medication deficiency. And so if we look at the lifestyle areas first, that definitely will help. And even again, if you need the prescription, that's great. But addressing lifestyle is going to help support health overall as it is. So I love that advice.
Without a doubt. You're absolutely right. Yep.
For people that are listening on the go and are not going to click the show notes, where's the best place to find you?
My website is the best place, nbihealth.com. The company is Nutritional Biochemistry Incorporated, or NBI, and the URL, the website is nbihealth.com.
John, thank you so much. You have given us a lot to think about and a lot of amazing gold today.
Thank you.
For everyone listening, remember you can get the transcripts and show notes by visiting inspiredliving.show. I hope you enjoyed this episode as much as I did today. I'll see you next week.
Thank you for listening to Julie Michelson's Inspired Living with Autoimmunity. Did you enjoy this episode? Please like, share, and subscribe wherever you listen to podcasts. If you'd like to get a transcript of this and every other episode, just head on over to inspiredliving.show or click on the link in this episode's description. There, you can also find everything we discussed in this episode, including links and information about our guest. You can even send in your questions to be answered by Julie in a future episode. That's inspiredliving.show. Until next time, this is Julie Michelson's Inspired Living with Autoimmunity podcast, helping you take your power back.